imagine a woman present with heavy menstrual bleeding. Another patient has a feeling of something bulging into the vagina, and in another patient, tumor develops in the uterus. All three conditions look differently, but to understand all of them, you need to understand one structure properly, that is the uterus. And here's the interesting part: if you understand the position, supports, ligaments, and relations of the uterus, make clinical conditions like uterine prolapse, fibroids, and cervical carcinoma becomes much easier to understand. And so, in this lecture, we are not going to simplify, memorize the uterus, and we are going to build in your mind. Before we start, understand this topic so important for MBBS, and uterus is very common anatomy question. You can be asked its situation, size and shape, parts, relations, ligaments, supports, arterial supply, lymphatic drainage, position, and clinical anatomy. And one of the biggest mistakes students make is in learning all these as a separate facts. Don't do that, because actually everything is connected. For example, why does the uterus normally remain tilted forward? Because it's supporting the structures. The why can uterus prolapse? Because those structure supports become inadequate. Why does the uterine cavity have tortuous course? Because the uterus needs to enlarge during the pregnancy. So let's build the uterus from the basics. Uterus is shallow, muscular, pear-shaped organ of the female reproductive system. Its major role is reproduction. But don't think of it as simply a place where the fetus stays. Think of the uterus as a dynamic muscular chamber. During pregnancy, it provides the environment for the implantation and development of the conceptus, and during the labor, its powerful muscular contractions help in expulsion of the fetus. So remember, uterus is useful in implantation, pregnancy, and labor. Now, where exactly it is? It lies in pelvis between the two very important organs, that anteriorly urinary bladder, here the uterus, and posteriorly by rectum. So whenever you imagine the uterus, put it between the bladder and rectum. That the single relationship will help you to remember. Now let's talk about the normal and non-pregnant uterus. Its shape is classically described as a piriform or the pear-shaped, and the approximately dimensions are the 7.5 centimeter long, 2.5 centimeter thick, and breadth is 5 centimeter. But here's the something important, that don't memorize these numbers randomly. Visualize the uterus as the small muscular pear, and broad above, narrow between, and broad upper part is mainly the body and fundus, while the narrow part is continues into cervix. And that takes us to its parts of uterus, that anatomically we divide the uterus into fundus, body, and cervix. And we also describe its two lateral borders. Let's understand each one. Fundus is the part of the uterus lying above the openings of uterine tubes, and think of it as a rounded roof of the uterus. Here is the fundus. Here is the fallopian tube. It is the fundus. Free superiorly convex and covered by peritoneum. Now here's the clinically interesting point, that during pregnancy uterus expands enormously, and the fundus become clinically useful because its height can be assessed abdominally and to estimate the progress of the pregnancy. So this is not just an anatomical roof, it's an important clinical landmark. Body is below the fundus, called as the body, and the body forms approximately the upper 2/3 of the uterus. It continues inferiorly towards the cervix. And now look at the body, that it has two important surfaces, that anterior surface and posterior surface. Anterior surface also called as vesical surface, and posterior surface also called as intestinal surface. Anterior and posterior surfaces, let's see in detail. The anterior surface is relatively flat, and what lies in front of it? The urinary bladder. This relationship is important because the peritoneum reflects between uterus and the bladder to form the vesico-uterine pouch. So, whenever you hear vesico-uterine pouch, immediately think anterior relation of the uterus. And the posterior surface, now turn to this. This surface is a convex, and posteriorly, we have the rectum and intestinal structures, including coils and intestine and the sigmoid colon. depending on the exact level and relation. Peritoneum here forms the rectouterine pouch called as pouch of Douglas, and this is extremely important anatomical space. So here's the your important memory that in front is a bladder, vesicouterine pouch, and at the back rectum, rectouterine pouch. Here we will see quick recap that the uterus is pear shaped, fundus is top, and the main upper two-third called as body, lower part cervix, front bladder plus vesicouterine pouch, back rectum plus rectouterine pouch. Let's see the lateral borders. These borders are rounded and convex, and they are important because they provide attachment to broad ligament of the uterus. At the junction of body and fundus, we have the cornua or the uterine angle. And cornua is extremely important because several structures are associated with it. The uterine tube attaches here, and the ligament of ovary attaches here. And the round ligament of the uterus also begin in this region. Now let's reach to this next part, cervix. Cervix is the lower cylindrical part of the uterus, approximately 2.5 centimeter long. Unlike the body, cervix has a very important relationship with vagina. The lower part of the cervix projects into the vagina, and this creates the two parts, that the supravaginal and vaginal part. Supravaginal part lies above the vaginal attachment, and vaginal part projects into the vagina. Like this is cervix and this is vagina, so this is vaginal part and this is the supravaginal part. Now, why are the fornices important? Because they surrounded the vaginal part and cervix and create the clinically important spaces around it. Inside the cervix, there is the cervical canal and has two openings. Upper opening is internal os and lower opening is external os. This is one of those sequences you should know instantly, that uterine cavity, internal os, cervical canal, external os, and the vagina. And the cervical canal is not just the empty tube, its anterior and posterior walls have mucosal folds, and that mucosal folds called as the arbor vitae uteri. Why this name? Because the folds have branching appearance resembling a tree, and the folds from two walls interlock with each other, and this helps to keep canal relatively closed. So don't memorize arbor vitae called as the mucosal folds, and here are present the arbor vitae uteri. So two folded walls interlock and cervical canal remains closed. Next we will see the ligaments of the uterus. Highest yield areas of the uterus, ligaments, and students often make one mistake here. They assume every ligament of the uterus provide major mechanical support. That's not true. Some are mainly peritoneal folds and some are fibromuscular fold supports, and one particularly helps to maintain the position of uterus. Let's separate them. And here is one broad ligament. First, it is broad ligament is essentially a double fold peritoneum extending from the uterus towards the lateral pelvic wall. It has anterior and posterior surfaces. Its medial and uterine attachment is along the lateral margin of the uterus. It is the uterus, it is a large lateral margin, and structures related to it, that uterine tube, ovary, round ligament, nerves, lymphatics, and connective tissues. The part of the broad ligament associated with uterine tube called as the mesosalpinx, and the part associated with the ovary called as the mesovarium. So, large part of the associated with uterus is called as mesometrium. So, you should remember salpinx, mesosalpinx, ovary, mesovarium, uterus, mesometrium. Very easy. Let's discuss in detail the fibromuscular ligaments. Now, major fibromuscular ligaments are the condensation of the endopelvic fascia, that includes transverse cervical ligament, pubo-cervical ligament, and round ligaments of the uterus. These are much more important for maintaining the position of cervix and uterus. Think of them as a supporting straps around the cervix, and the transverse cervical ligament extends laterally towards the pelvic wall, and uterosacral ligament connects the cervix towards the sacral region. Here is one diagram for you. Here, transverse cervical ligament. Here is the pubocervical ligament from cervix to pubis, and together these structures help prevent excessive displacement of the uterus, and this becomes extremely important when we discuss the uterine prolapse. So keep that questions in your mind, and what happens if these supports fail, we will come back to it. This is uterus, and this is the superior view for see the ligamentous support. Let's discuss about the round ligament. This is the another structure students commonly confuse with main support, that the round ligament. This is another structure students commonly confuse with the main supports. The round ligament is a fibromuscular flat band and approximately 10 to 12 centimeter long. It begins near the lateral angle of the uterus close to uterine cornea, and then it runs forward and laterally, enters the deep inguinal ring and passes through the inguinal canal, reaches to the labium majora. This is the favorite anatomic question, that uterus goes into deep inguinal canal, from uterus to deep inguinal canal to the inguinal canal and then to the labia majora. Now, why does it exist? Its important role to help to maintain the uterus in its anteverted position. So, remember, round ligament maintains the anteversion position. We will discuss anteversion later. Not a primary support against the prolapse. It's not primary but support for the ligament during prolapse. What actually keeps the uterus in position? Think of uterine support as a team effort, and not one ligament. There are active muscular supports and passive fibromuscular supports. Primary or active, that the most important muscular supports is in the pelvic diaphragm, especially the levator ani, and the other structures associated with the support include perineal body and perineal musculature. Here, and imagine placing a highly heavy object on the hammock, and hammock supports it from the below. That's essentially what the pelvic floor does for the pelvic organs, and this explains the something clinically important. If the pelvic floor supports become weak, pelvic organs can descend. Fibromuscular support. Then we have fibromuscular condensations of endopelvic fascia and the cardinal or the transverse cervical and cervical and the uterosacral ligaments. These stabilize the cervix and uterus, and the round ligament helps to maintain the uterus in its forward tilted position. Now look at diagrams carefully for the anteversion and anteflexion of the uterus. Let's look at this. The uterus normally has two important positions, that anteversion and anteflexion. Let's make it impossible to forget that anteversion refers to forward inclination of the uterus as the whole relative to the vagina. Think, it is the uterus forward relative to vagina, that is the anteversion. Now look at the angle between body of the uterus and the cervix. Here is the body of the uterus and the cervix. Here, if the body bends forward relative to cervix, that's called as anteflexion. Version is related to uterus and vagina, and flexion is related to body and cervix. This distinction is the classic exam trap. So remember, version, position of uterus related to vagina, and flexion, bending of the body related to cervix. Now let's move to the vascular supply. The chief arterial supply of the uterus is made by the uterine artery. Uterine artery, and it receives additional contribution from the ovarian artery. In this diagram, this is the uterine artery, it is tortuous, and it is the ovarian artery. The uterine artery gives branches to structures including uterus, cervix, and vagina, and contributes to blood supply of the uterine tube and ovary. Now here is beautiful anatomical adaptation. The uterine artery is tortuous. Why? Because the uterus has to enlarge enormously during pregnancy. If the artery were completely straight and rigid, expansion of the uterus could stretch it severely. So its tortuosity provides the extra length to the uterus. Let's see the lymphatic drainage. Here, don't try to memorize one single lymph node for the entire uterus. Different parts drains differently. And the fundus, it is the upper part Fundus, lymphatics can follow the ovarian vessels towards the para-aortic and the lumbar nodes. And some lymphatics from the fundus can also follow the round ligament toward the superficial inguinal lymph nodes here. And the lower uterus and the cervix towards the pelvic lymph nodes, including external iliac and internal iliac and sacral nodes. So your visual map should be upper uterus, para-aortic, along round ligament. It is superficial inguinal lymph nodes, and lower uterus and cervix, pelvic lymph nodes. This becomes particularly important in the spread of the uterine and cervical malignancies. Now let's bring the clinical anatomies, because anatomy becomes memorable only when you understand why it matters clinically. Let's see. First one is the uterine fibroid. A fibroid is benign tumor of the smooth muscles of the uterus. Many are asymptomatic, but depending on their size and location, they are produced heavy menstrual bleeding, pelvic pressure or pain, and reproductive problems. So, if woman presents with excessive menstrual bleeding, uterine pathology should be part of the clinical thinking. Second one is cervical carcinoma. This is important gynecological malignancy and is highly relevant to MBBS because of its association with abnormal vaginal bleeding and especially during postcoital bleeding. Or the other symptoms can occur in advanced disease, and the anatomy matters because the cervix is directly related to the vagina and surrounded by important pelvic structures. That's why understanding the cervical anatomy is not optional. Also, don't blindly memorize old epidemiological percentages from notes. Cancer statistics vary by population and over time. For exams, follow the current standard textbook or guidelines used by your universities. And finally, one of the best examples of uterine supports matter, that uterine prolapse. Uterine prolapse means downward displacement of the uterus from the normal anatomical position with the descent towards or into the vaginal canal. Now think back what we learned, what supports the uterus, that the pelvic floor and the perineal body. The fibromuscular supports around the cervix, and if these supports become weak or damaged, the uterus can descend. Patients may describe the feeling of heaviness or pressure in vagina, bulging mass, or discomfort, including sexual discomfort. So, don't memorize prolapse as an isolated clinical fact. Okay, let's revise the all in 1 minute. That uterus is hollow muscular pear-shaped reproductive organ, size approximately 7.5 centimeter long, 2.5 centimeter thickness, then fundus upper side, then body, then cervix. Body is upper 2/3, cervical is cylindrical part and approximately 2.5 centimeter. Cervical canal has internal os, cervical canal and external os, anterior relation, bladder, and has vesicouterine pouch. Posterior relation, rectum, has a rectouterine pouch. Broad ligaments, peritoneal folds. Its subdivisions are mesosalpinx, mesovarium, and mesometrium. Important fibromuscular supports, that transverse cervical ligament, pubocervical, and uterosacral ligaments. Round ligament originates from the uterine angle and the deep inguinal ring to the inguinal canal and to the labium majora. Functionally important for maintaining anteversion. And the position, anteversion, uterus related to vagina, anteflexion, body related to the cervix. Arterial supply by the uterine artery mainly, and contribution by ovarian artery. Lymphatics by upper uterus by the para-aortic nodes, lower uterus and cervix drain mainly by pelvic nodes. Fundal drainage also able to follow the round ligament to superficial inguinal nodes. And clinically, the uterine fibroids, cervical carcinoma, and uterine prolapse. And congratulations, you have learned all about the uterus. And if you like it, share, like, and subscribe. Thank you.